Hello, this is Gilgamesh. I'm going to cover this story about this bioweapon lab, Fort Detrick in Maryland. It's where in 2019 they had a lab leak. They were working on COVID-19 on the very virus that leaked out of that Chinese at the Wuhan lab. Well, I believe that the origin of ours is from this lab because, well, look at the Pacific Ocean. How could it, and answer this seriously, when it leaked out of there, why did it hit us so quickly from there? There's no way it could have gotten here and hit America as hard as it did unless it was released here. And that's why I believe that Donald Trump pointing the finger at China is because he didn't want people realizing it was done under his watch in this country. Another good reason why I'm never voting for Trump. Let's look at this. I've got quite a bit on it, so it's going to be a good video. This is one that people should know, and I learned this from Redacted, so that's why I'm covering this, because not very many people are really talking about this. So here we go. Suspect number one, why Fort Detrick lab should be investigated for global COVID-19 origins tracing. Why U.S. labs need to be investigated for COVID-19 origin. Yeah. The lab leak theory that COVID-19 was leaked from a laboratory has once again caused a clamor since the beginning of this year. Months after the argument was thrown into the trash can of conspiracy theories by an overwhelming number of scientists, observers found that things only get more complicated when the origins of the coronavirus, an already difficult scientific issue, is entangled in political manipulation tricks. Combing through more than 88,000 pieces of news reports related to the lab leak theory, the Global Times found that as many as 60% of the coverage was from the U.S. alone. Yeah, trying to blame China for all this. And I believe that we went in under Trump, authorized them to go in. Because I remember when the media said it, we're going into China's labs to help them build up their vaccine programs. But I believe they went in there for sinister reasons to create this, to leak it, because they want to, I think honestly, get rid of the Chinese. They were hoping to kill the Chinese and then the Russians so they could take their resources. I think that's why they created this, but they screwed up here and it got out here. Yeah. It is worth noting that many media outlets in the U.S.-led Western world, which hyped the lab leak theory, are only willing to focus on the Chinese labs, though they have been thoroughly investigated by the World Health Organization, while turning a blind eye to the more suspicious American biological research institutions such as the infamous U.S. Army Medical Research Institution of Infectious Diseases, U.S. ARMID, at Fort Detrick in Maryland. Yeah. The USA was temporarily shut down in 2019 after a Centers for Disease Control and Prevention inspection. Although this mysterious lab reported the reason for the closure as ongoing infrastructure issues with wastewater decontamination, the explanation was not persuasive enough. The Global Times found that the lab's failure to control toxins seemed to have alarmed the centering weapons of mass destruction related institutions in the U.S. Resurgency of lab leak theory. A joint study into the origins of COVID-19 by Chinese experts and the WHO in March dismissed the lab leak conspiracy as theory. More evidence pointed to the fact that the virus had probably jumped from the bats to humans via another intermediary animal, and it was extremely unlikely that it leaked from a lab, the study reported said. Nevertheless, the lab leak theory has not disappeared. Instead, especially from the beginning of May, it has been largely promoted by some U.S. politicians and media outlets as a plausible science. In an article published on Bulletin of the Atomic Scientists on May the 5th, without any evidence, science writer Nicholas Wade claimed the proponents of lab escape can explain all the available facts about SARS considerably more easily than can those who favor natural emergency. Days later, the Wall Street Journal reported on May the 23rd that 3 researchers at Wuhan Institution of Virology became sick enough in November 2019 that they sought hospital care, and they had symptoms consistent with both COVID-19 and common seasonal illnesses. The Wall Street Journal report quoted a previously undisclosed U.S. intelligence report. On May the 26th, President Biden stated that he had ordered the U.S. intelligence community to redouble its efforts to investigate the origins of COVID-19. The U.S. National Security Advisor Jake Sullivan even claimed on June the 20th that China will face isolation in the international community if it doesn't cooperate with a further probe into the origins of COVID-19 pandemic. Bloomberg reported that day. Well, China's never going to cooperate with you. Pressure from politicians and the media seems to have affected some authoritative medical scientists in the U.S., including Director of the U.S. National Institute of Allergy and Infectious Diseases, NORAD, I think that's how you pronounce it, NIAID, Anthony Fauci on May the 11th, I think the second, or it looks like it's supposed to be second, after Rand Paul, a Republican, to the Senate, accused Fauci of helping the Wuhan lab create the virus. Fauci strongly denied the accusations, but said he is fully in favor of a further investigation of what went on in China. Why don't they look over here? This sudden change in attitude of some U.S. experts is due to the political pressure they have received. A Chinese virologist told the Global Times Western media like to ask the experts misguided questions like, is lab leak absolutely impossible? Said the virologist who requested anonymity. It's very difficult for experts to answer a question like that, as the possibility, although very little, still exists, the virologist said. All they can say is, it's possible, he's told. Sorry, dry throat. He told the Global Times, actually, most experts usually add, but it's highly unlikely after it's possible, but the media only presents the part which confirms that their own bias, he said. Big data shows the U.S. is pushing the narrative of the COVID-19 lab leak theory. Among the 8,594 pieces of news reports related to the lab leak that database GDELT collected since 2020, 5,079 were from the U.S., accounting for 59%. Following the U.S. was the UK, 161 pieces, and in Australia, 597. Almost all coverage targeted the Wuhan lab. While the U.S. is solely focused on Chinese labs, the U.S. seldom pays attention to the fault in its own domestic labs, some of which have even triggered virus-related accidents before. According to an August 2020 article by ProPublica, an independent newsroom that produces investigative journalism. The University of North Carolina in Chapel Hill reported 28 lab incidents involving genetically engineered organisms to safety officials at the National Institute of Health between January 2015 and June 2020. 6 of the incidents involved various types of lab-created coronaviruses. ProPublica said that the article, many were engineered to allow the study of the virus in mice. Weirdly, very few U.S. mainstream media outlets have raised the question whether there is the possibility that COVID-19 was leaked from the U.S. labs, said the Chinese virologist. Why dare not ask? They dare not ask that, he said. In an article published on the independent political site Moon of Alabama on May the 27th, the author pointed out that some Westerners' hyping of the Wuhan lab leak conspiracy is similar to the trick the U.S. played in pushing the Iraq War in 2002. The U.S. claimed Saddam Hussein will soon have nuclear weapons, which was obviously nonsense, the author said. The lab leak theory is similar to the weapons of mass destruction claim, evidence-free speculation long promoted by a neoconservative leaning administration that was extremely hostile to the guilty country in question, said the author. The lab leak theory, therefore, isn't just about an implausible, evidence-free tale of a SARS-CoV lab escape, the author noted. It is a campaign launched to depict China as the enemy of mankind. Intel concerns on U.S. biolabs. The U.S. has many biolabs in 25 countries and regions across the Middle East, Africa, Southeast Asia, and the former Soviet Union states, with 6 in Ukraine alone, we know. Some of these labs have seen large-scale outbreaks of measles and other dangerous infectious diseases, according to media reports. Yep. The international community has frequently expressed concern over U.S. biological manipulation activities in other countries. In October 2020, Deputy Chairman of the Security Council of Russia, Dmitry Medvedev, said that the U.S. research activities in biolabs in members of the Commonwealth of the Independent States have caused great concern. The U.S. not only builds biolabs in these countries, it also tries to do so in other places across the world. However, its research lacks transparency and runs counter to the rules of the international community and international organizations. Oh my God, what is this? Anatoly a corresponding member of the Russian Academy, I probably butchered that name, Academy of Military Science and Associate Professor of Faculty of World Politics at Leninskov Moscow State University, told the Global Times that biological and bacteriological weapons tests on U.S. territory are prohibited by the U.S. Congress. He said that the U.S. military has been and is still carrying out tests in biological and bacteriological weapons in Georgia. This is done under the guise of providing the sick people with various therapeutic vaccines conducted by the U.S. military and American private contractors at the Richard Lugana Center for Public Health Research. He said related tests have been exposed by various media outlets. In December 2015, 30 patients at the research center who had been treated for hepatitis C died. 24 of them died on the same day, and their cause of death was listed as unknown, according to Tazagongyok and Russia news outlets. Residents of neighborhoods around these labs often complain about health problems. Bulgarian journalist Dilyania Gaetana, I'm not going to pronounce that last name, published a story about the Luger Center in early 2018 in which interviews for the report most residents who lived nearby the labs complained of headaches and nausea and high blood pressure. They also said there was black smoke coming from the lab. USA Today reported since 2003 hundreds of incidents involving accidental contact with deadly pathogens occurred in the U.S. biolabs at home and abroad. This may cause the direct contacts to be infected who can spread the virus to communities and start an epidemic. A member of the Russian Academy of Science, Armis Kamalov, said in an interview with TASS in early June that development of genetically engineered viruses as biological weapons should be subject to the same worldwide ban as the testing of nuclear weapons. He mentioned U.S. labs in Georgia and Armenia as reference. There are a lot of labs that have been bankrolled today by the U.S. Department of Defense. It's no secret that they are in Georgia, Armenia, and other republics. It's a surprise that access to such labs is off limits, and we do not understand what they are doing there. He said, which he's right. What happened in July 2019? The terrible safety record of American biological labs around the world shows a possibility of a virus escaping from an American lab. Many point to the shutdown of Fort Detrick lab in July 2019. In July 2019, 6 months before the U.S. reported the first COVID-19 case, Army laboratory at Fort Detrick that studies deadly infectious materials like Ebola and smallpox was shut down after the U.S. Center for Disease Control and Prevention issued a cease and desist order. CDC officials refused to release further information after citing national security reasons. Oh yeah, we know why. U.S. Embassy in Fort Detrick said in August 2019 that the shutdown was because the center did not have systems in place to decontaminate wastewater from its highly secured security labs, and the New York Times reported. What exactly happened at Fort Detrick in the summer of 2019? Some U.S. media previously turned on to CDC to get answers, but many key contents in the report have been redacted. In early June, a Virginia-based Twitter user got the CDC documents on the inspection of Fort Detrick under the Federal Information Act, FOIA. Global Times found that most of the documents were emails between CDC officials at various departments and the USA MRID from 2018. 2018, although some of the emails were covered by an ABC-affiliated television station in Washington, the report did not catch much attention. The emails revealed several violations at Fort Detrick lab during CDC's inspections in 2019, 4 of which were labeled serious violations. One of these serious violations, CDC said, was one inspection who created a room multiple times without the required respiratory protection, while other people in the room were performing procedures with a non-human primate on a neuroscope table. The deviation from entry procedures resulted in a respiratory occupational exposure to select agent arsenal, the CDC said. In another serious violation, CDC said the U.S. MRID had systematically failed to ensure implications of biosafety and contamination procedures commensurate with the risk associated with working with such agents and toxins. The other violations included a lack of proper waste management, where waste wasn't transported in a durable leak-proof container, which created the potential for spills and leaks. Failures that are risk associated with other violations include lack of proper waste management, where waste wasn't transported in. Okay. Spills leak. The CDC document showed that it sent a letter of concern to USA AMRID, which resulted in a temporary shutdown of Fort Detrick in 2019. In an email on July the 12th, 2000, the CDC said the report 2 breaches of contaminant on June 1st and July 1st and 2nd. In 2019, and this deconstructed a failure of the USA AMRID to implement and maintain containment procedures significant to contain select agents of toxin generated by BSL-3 and BSL-4 laboratory operations. Effective immediately, the USA AMRID must cease all work involving select agents and toxins in registered laboratories areas until the root cause investigation has been conducted for each incident and the results have been submitted to FSAP for review, the CDC said. FSAP, Federal Select Agent Program, is jointly comprised of the Centers for Disease Control and Prevention Division of Select Agents and Toxins, the Animals and Plant Health Inspection Services Division of Agriculture, Select Agents and Toxins. The program oversees the possession, and use of transfer of biological select agents and toxins, which have the potential to cause severe threats to the public, animal, or plant health, or to animal or plant products. Common examples of select agents, toxin, including the organisms that cause anthrax, smallpox, and bubble ox plague. Oh my god. I sort of lost it for a minute. The program oversees, but okay. Animal to common examples of such agents and yeah, I read that. 3 days later, the Fort Detrick reapplied the email by saying that it had submitted messages in response to the immediate action, but the messages were deliberately blotted out. The message was submitted by a director for strategic studies countering weapons of mass destruction at a U.S. whose name was also blotted out. Fort Detrick's public statements released in August 2018 said the shutdown was due to problems in decontaminated wastewater. Shut down due to problems but it's not clear whether the statement was consistent with CDC inspection results. The management of such high-level labs in general must be very strict with regular inspections. Various systems should be able to ensure that no potential risk can occur, and equipment failure and wastewater leakage certainly should not occur. A Chinese scientist from the Wuhan, China virus origins tracing. God damn it. Management highly level lab. Very strict with regular various systems. Implementation of wastewater. Chinese scientists from the origin tracing team who requested anonymity told the Global Times. The wastewater problem revealed major loopholes in the management in the Fort Detrick lab, and one has to wonder what else was leaked with the mismanaged wastewater. Some highly pathogenic pathogens in the laboratory were likely released, and the U.S. military never told the public about what they were doing, scientists said. It is highly likely researchers at Fort Detrick may have been infected and accidentally but showed no obvious symptoms. In this way, they could have brought the virus to the outside world, the scientists said. Under the circumstances of no obvious symptoms, 9 of the 10 individuals may not have known that they were infected, and it's possible that more than 90% of transmission routes have been lost when the virus was finally detected. This is also why the tracing of virus origins is difficult to conduct, he said. Noting only serological survey on a large scale could find some of the early infections. Why not open Fort Detrick? Several biologists and analysts interviewed by the Global Times urged the Fort Detrick lab to open its doors for another international investigation, since international experts have already visited the Wuhan laboratory. My God. Experts open the door for another. Okay. Experts have already visited the Wuhan Institution of Virology. Many Western politicians and media outlets pinned the blame of the pandemic on Wuhan, saying that Wuhan was where the virus was first detected and where the virus came from, despite mounting evidence that it's not the case. In a recent example, in June, a research study ran by the National Institute of Health Olive U.S. research program found evidence of COVID-19 infection in the U.S. as early as December 2019, weeks before the first documented infection in the country. Wuhan recorded the earliest COVID-19 symptoms from a patient on December the 8th, 2019. When asked to give more detail on the study, a media person with the All of Us research program told the Global Times that the program has nothing further to add from the information it had already released. As for why the virus was first detected in Wuhan, the anonymous scientist said that the virus was difficult to be detected at an early stage, especially in aluminum and winter with more cold cases. It would still not attract attention until a large number of people were infected. That's what happened in densely populated Wuhan, the scientist said. China's public health systems is very sensitive, especially about the SARS outbreak in 2003, but this is not always the case abroad, especially when population density is low and the virus does not spread so fast, the expert said. The novel coronavirus was first discovered by 3 Chinese companies at the same time. It is very simple to detect these God damn it, I did it again. Chinese public case abroad, especially when the public density. Okay. The novel coronavirus discovered by yeah, I've read that. It is simply to detect these things, and China has lots of such third-party companies with strong medical detection ability, he said. Without going back to early serum samples elsewhere, now it is going to be difficult to find the source of the virus. The retrospective studies that have been done in China have not found any evidence. It's important for the world to work together now to sort through the evidence and to do early serological investigations where necessary, he said. Zheng Gang, a former chief epidemiologist of the Chinese Center for Disease Control and Prevention, told the Global Times that lab leak is easy to identify as infections are bound to show signs whether it is said for disease. Lab leak is infections around show. Okay. The WHO experts assessed the lab leak hypothesis when they visited Wuhan and found no evidence, and the speculation on its possibility in a Wuhan lab should have ended by now. In the meantime, we should put a question mark on other hypotheses, such as other labs around the world, Zhen said. Zhen said the U.S. is afraid of WHO's inspection in the same way it was done in China, Zhen said. The U.S., the only country obstructing the establishment of a biological weapons convention verification mechanism, has systematic problems, Zhen said, adding that the U.S. is afraid that the investigation into lab leaks would lead to more of its dirt being dug up. Yeah. U.S. urged to explain truth behind evol close of for Detrick Biolab. Yeah. In July 2019, there was an outbreak of the e-cigarette or vaping product used associated lung illness, EVALI in Wisconsin, the U.S. The disease then spread through multiple states, with doctors describing patients with symptoms that barely differed from that of COVID-19. From the cause of the illness was unknown. Coincidentally, it was also in July 2019 that the Fort Detrick biological lab was suddenly shut down, and that a retirement community an hour drive from the lab experienced unexplained respiratory diseases. What's the truth about EVALI outbreak? Why was the Fort Detrick lab shut down? Is there any connection between the Fort Detrick lab and the initial outbreak of COVID? I do believe yes. Yes. To answer these questions, lead radiologists analyzed 60 published research papers on e-cigarettes and influenza-caused pneumonia, and concluded that some of the EVALI cases in the U.S. in 2019 had got viral infection, and the possibility of them contracting COVID-19 could not be ruled out. How to diagnose a patient with EVALI? Experts provide some standards. The patient has used a vape e-cigarette within 90 days before the onset of symptoms. His chest X-ray and or CT show lung inflammation or pulmonary infection is found in the initial examination. There was no evidence of other reasonable diagnosis. Researchers selected 250 medical images of 142 EVAL patients from 60 research papers and invited 3 authorities, radiologists, to carefully study and review these images. The patient's clinical information, as well as the original papers. They found that 16 cases who were classified as EVALI patients, I think that's how you pronounce it, had viral infections. That is to say that they may be suspected patients for COVID-19. Moreover, the 16 patients were all from the U.S. 4 of them had an unknown duration of illness, and the other 12 had the illness before 2020, and 5 of the 16 patients with previously COVID. Moreover, the 16 patients were all okay. I've read that, and the other 12 were ill before. 5 of the 16 patients with relatively complete clinical symptom and treatment records were considered to be moderately suspicious for COVID-19. Some people may ask, on what basis did experts determine that EVALI patients had viral infection? What's the difference between viral pneumonia and EVALI? Experts say that EVALI does not have specific CT imaging or clinical Experts say that EVALI does not have specific CT imaging or clinical manifestation. According to published articles, it is a general term for pneumonia and e-cigarettes users who have no other reasonable diagnosis or evidence. experts determined whether EVALI patients had viral infections based on the CT feature. God damn it. I can get rid of this one. I've done it already. Okay. More two nursing homes nearby found respiratory disease unknown cause that caused pneumonia. In September 19th, Maryland, where the Fort Detrick Biolab is located, reported that the number of EVALI patients had doubled. The coincidence and the lung CT make people think of the connection between the so-called EVALI and novel coronavirus. Actually, it's not the first time that the Fort Detrick lab has been involved in viral leaks. Public information shows that Fort Detrick, MD, was created in the middle of World War II and became the Center for America's Biological Warfare efforts. It stores deadly viruses such as Ebola virus, anthrax, and those words I can't pronounce. In 1990, Fort Detrick Lab, a laboratory that should have been highest level of biological security, had risk of Ebola virus leaking according to the U.S. media reports in the early 1990s. Fort Detrick Biolab reported that leak of lab specimens of anthrax, spores, Ebola virus, and other deadly pathogens disappeared from the Army's Biological Warfare Research Facility at Fort Detrick in the early 90s. During the turbulent period of labor complaints and recriminalization among rival scientists, their documents from an internal Army inquiry show, as reported by the Baltimore Sun, in 2023, the Washington Post reported that more than 2,000 tons of hazardous waste has been unearthed, including vials of live bacteria and God damn it. The Washington Post reported that more than 2,000 tons of were unearthed, including viral bacteria, anthrax, and that the military did not know was buried there, Fort Detrick official says. In 2018, a paper published by Fort Detrick showed that it conducted an in-depth study on the pathogenetic respiratory characteristics of potential A/B biological warfare agents from community. According in 2018, a paper, showed the pathogen of potential pneumonia, including that the Biolab is still carrying out searches related to biological warfare agents in the respiratory tract. Moreover, what is jaw-dropping is that in order to save costs, this laboratory of highest security level hired a company with multiple violation records and unqualified management to deal with its medical waste. Some commentators pointed out the that U.S. military and its cold chain blood packages use a loophole in the Europe's COVID-19 prevention works. In March 2020, the Net Citizens petitioned on the White House website asking the U.S. government to release the real reason for choosing the Fort Detrick Biolab to clarify whether the laboratory is a research center of the novel coronavirus or whether there were problems such as a virus leak. However, the U.S. government chose to remain silent. Yeah. German, whoops. Oh, this is the New York Times. I'm not going to fucking do. Okay, COVID-19 research and the integrated. Yeah, so this is, let's see how long this one is. This is basically what this is. This right here is the mock high dose. Yeah, they're showing you young, aged. This is, yeah. So here we have proof of the, yeah. So I want to do this real quick. Yeah, this came from that. Most likely, this is your proof that it did leak here. So this is Gilgamesh. I will talk to you later. Bye.